Good afternoon from the heath that is Hampstead, and here we start our little woody walk. And in discussion today is Julian Assange plight, obviously, and the problems, the pandemic problems in our public institutions. And recently Hancock, the health secretary, has promised that they will provide testing for all residents in these care homes and staff if they are symptomatic of the virus. Thank you, Hancock, for your contribution there, promising these things. But Public Health England says these systems and these safeguards have not yet been established. So porky pies you're telling, Mr. Hancock, with your everyone's going to be tested and it's all safe and cushy. Not yet established, indeed. Care home providers, both the public and private ones, are pleading for the testing, the protection for their staff and workers, and the equipment. It's disgraceful, absolutely. And in the UK, as of today, we have over 17,000 who have perished. An underestimate by many claims, and a damnation of our government's pandemic response. And on a personal note, I had a family member who's just been forcibly discharged from a residential hospital unit, and I remonstrated with the care home team and demanded that she have a test before they consider moving her anywhere, especially to a unit where she lives with a majority completely of the over 65s. I was ignored, and when I asked them politely, had their own staff been tested and did they have adequate equipment and facilities, they hang up on me. Lovely, thank you. The death toll of the elderly and the sick is an ageist cleansing policy. Sinister, callous, corrupt and negligent, unseen since the times of imperial Rome and ancient Assyrian invasions. Julian Assange, these care home statistics are shocking, appalling. Out of the over 17,000 deaths, 7,500 are from these homes. That is 43% of the UK fatalities are in these public and private institutions. Disgusting, shocking, outrageous. And Julian Assange in the prison system is suffering worse. And maybe in these care homes they provide a semblance of reasonable care and making sure the residents are not neglected, whereas in Belmarsh Prison, especially Governor Rob Davis's regime of isolation and torture, such niceties have long been dispensed and his suffering and his risk is most probably greater than that of an elderly person in a public institution or a private institution. No tests, not enough protection, and very limited equipment. And this, we got to free Julian Assange. And we're fighting against aging cleansing, ethnic cleansing, genocide, and the destruction and ruination of civilian life. Here, press on the heath and on the pulse of public outrage.